Yeah. Nice to meet you.
Did you meet Dr. Fry?
We did.
Dr. Fry. Okay.
Julie, she used to run things around here.
We've met a couple of times now.
Yeah.
Yes, ma'am.
You were from Dillon.
Yeah. You met Will, huh?
Yeah, I did.
He's gonna get.
I have to sit down here.
Stand whatever you feel most comfortable doing.
Tim, thank you for coming tonight. Welcome to Floresville. I see you had a busy day, and I'm sure you have met a lot of people. And the first part of our interview is who all on the medical staff did you meet today?
You take notes?
Names, especially.
Names. Okay, but we're glad you're here tonight. We appreciate the opportunity. I think we'll start by giving you the floor and telling us something about yourself and your past and professional experience, etc.
Sure. Appreciate that. Allow me the opportunity to be here. And I'll be brief. I know y'all read that. Some of us have read it. So I'll just be brief. Basically the same speech. I know Carl and Kurt should get tired of hearing it, so I'll try not to repeat myself too much, guys. But father was a hospital administrator for 40 years, worked for Scott White. Followed in his footsteps right on. Ran different healthcare is the only thing I've ever done. Right out of immediately after getting out of school, went to work for Scott White. Worked for them for whatever that thing says, about 10 or 12 years. Started at the ground floor, kind of an entry-level position in the business office. Worked my way through financial counseling, learned a lot about insurance, billing, collections, kind of the cash flow piece of the business. Got an opportunity to apply for and was granted the position that became open on the clinic side of Scott White, which was within the the regional clinic management trainee program. That trainee program lasted about 6 months, and that turned into a position in Gatesville ultimately. Gatesville was kind of my hub. Gatesville had about, depending on which year it was, anywhere from 6 to 7 primary care docs and a general surgeon, up to 11 or 12 primary care docs and a general surgeon and a radiologist. So depending on what year through that time span there, 94 through 2003, depending on what year it was, there's quite a few docs involved in there. And I just mentioned that Gatesville was the hub. Scott White kind of used me as the western guy on their front. We put in a rural health clinic in Meridian, Texas, which is north of Waco. We assumed purchased a clinic in Brownwood, Texas, which was to our west. We had put in and operated a clinic in Goldthwaite, Texas, which is a little bit to our west. Scott White used me for all those endeavors, so I kind of roamed around like always came back to Gatesville at the end of the day. That was kind of my home. And we worked with Coryell Memorial Hospital in Gatesville, which was right across the street from the hospital. From our clinic. And our doctors at Scott White were the sole providers or the sole members of the medical staff of Coryell Memorial. So worked very closely in the hospital environment with them. Did that through 03. Opportunity I knew was coming up in 04 because Wendell McCord, who was the administrator at Brady, called me and said he had a rural health clinic and he needed some help and he wasn't going to be working at the hospital a whole lot longer. So turned in my keys and badge to Scott White. We moved west. Wendell had just certified the clinic as a rural health clinic, which I know some about since we certified one in Meridian and in Goldthwaite. So that was kind of my strength there. They had a kind of a classic cash FTEs and payables issue in the clinic, which was fairly easily to rectify. Didn't have to let anybody go, fortunately. Just kind of had some folks in the wrong spot. But the main problem was we weren't getting the bill out the door, therefore we weren't getting cash back in the door. So fixed that. Before Wendell left, he kind of turned me to some operational issues that were going on in the hospital. Nothing of great significance there. He retired shortly thereafter in July of 04, August of 04. Anyway, the board asked me if I wanted a shot at it, and I said sure. And they they said, we have $500,000 in the bank, we've lost money for the last 5 years, here's the keys, don't let it sink. Very much. So, keep it close. And we literally were, we were about 9 days from borrowing money to make payroll. And cash FDs and payrolls, that was the first thing we had to fix. And it took about a year. We made money the first year on operations. And from the time period of fiscal year 05 through 12, we made money, I think, every year but 2. And don't quote me on that. You've got the reports there in front of you. I think in a couple of years we lost $50,000 or $60,000 on operations, but all in all, we had a net increase of assets in all those years. After 05, after we kind of had our ugly year, if you will, the tough one where we had to let a few folks go and do away with a few positions, started to focus on the business, growing things back, pulling things back together. And we really started working on our relationship with our big providers close to us, which was and is Hill Country Memorial in Fredericksburg, and then Shannon Medical Center in San Angelo, about 75 miles to the west. And I'm not real sure that it's on that CV. That's been our savior to date. We have about 19 visiting specialists that come from Shannon, or San Angelo, to our west, and then Fredericksburg to our south. And we're a significant piece of both of their markets. So it's been interesting to work with both CEOs of those facilities. They're both very intelligent, very bright men. And know them both on a first name basis, fortunately. And but it's just interesting the dynamics from a competition standpoint, or competitive standpoint. You get a cardiologist from San Angelo, and we'll get a cardiologist from Fredericksburg a week later. So my wish list, if I ever get my first position on the wish list, the second one's right behind them, so I get 2. It's really an interesting dynamic. It has come to pass. It's been very beneficial to our patients, helpful certainly to our bottom line. We struggle like all rural community hospitals with the primary care. We've got lots of hooks in the water, as our board chairman likes to say, in terms of recruiting firms. Been successful in recruiting to our community. Need to be more successful, need to continue with that. We've got 3 full-time family medicine physicians that are in town. We need about 6 in order to service our market that we have. And hopefully the community will respond in terms of growth to that. We've got a lot of outbound healthcare that we simply can't take care of. Our 35 patients a day, sometimes 40, so we need some help. And I know whenever we get that help, the community will respond to that and stop driving all the way to San Angelo to go see a family medicine or a pediatrician. So that kind of brings me to where we're at today. We did build the facility. We were on track to break ground in late 08, 09. The stock market tanked. We had to go out and find a new lender. Fortunately, the new lender was right there in town, so that worked out really good. And we opened the new facility in February this year, February 13th. 25-bed private room hospital, lab, X-ray, ED, surgery. It's what we jokingly call it's the clinical extension of the old facility. It's a hospital. The bean counters and the cooks and the housekeeping staff stayed over in the old hospital, and we're currently renovating. Broke ground on that project this week, renovating the old hospital into an outpatient dialysis center. And that's a collaborative effort between us and Shannon. We're doing the renovation and bearing the burden of that cost, and they are going to operate it as a critical access hospital. It simply does not work under the outpatient dialysis reimbursement to a CON to run an outpatient dialysis center. So because our board is committed to providing what the community needs, and because we have about 30 people within our immediate service area that have need for dialysis, we're going to partner with Shannon, let them run it. We'll just charge them rent, and hopefully that'll be a very positive outcome for the community. I think that'll be open in about 6 months. I hope I didn't leave anything out there. I kind of rushed through that kind of quick. Anything glaring there I left out?
is